And in the acne itself, there are different kinds of acne.
Yes.
Right? So is there something called fungal acne and regular
Yes.
acne?
Yes. So there are many different lesions of acne. So we need to understand acne. Mainly we categorize into two types of lesions. One is inflammatory acne and the other one is non-inflammatory acne. So non-inflammatory acne is the comedons, the whiteheads and blackheads. Those are non-inflammatory acne. And then inflammatory acne is everything else like papules, pustules, nodules, cysts. So these come under inflammatory acne. So what we think of acne, colloquially, is the inflammatory lesions. We don't think of...
When you say pustule, it's a small white thing that comes
Yes,
up.
a yellow pus point that you see with her slightly red base, that is a pustule. So when we talk about acne, when people say acne, they usually only refer to the red lesions if it's angry, but also whiteheads and blackheads are pre-acne lesions. So when you are developing blackheads and whiteheads, that means that your skin is acne prone. So if you take certain precautions, follow some certain skincare practices, it can really help in preventing eventual acne. Now, doctor, you said something about fungal acne. So there's a lot of misinformation of fungal acne, and I'm so glad you asked me this question because a lot of people are self-diagnosing fungal acne. Fungal acne is not so easy to diagnose. Firstly, you have to go seek expert advice. How is it different? The lesions look monomorphic, meaning that the lesions look similar. Usually in acne, it's polymorphic lesions. Some are papules, some may be pustules, some are whiteheads, blackheads. You see different type of lesions. But in fungal acne, you don't see comedons. You see multiple small, tiny pustules, mostly in the T-zone area. And they suddenly
T-zone
occur.
is this one?
Yeah, T-zone area. And they occur suddenly. Usually it happens after using too much of antibiotic creams or taking prolonged oral antibiotics, or you're using creams that's constantly damaging the skin barrier, or you live in a very hot, humid climate, or you have seborrheic dermatitis or dandruff. In those patients, we see fungal acne. It is not very common, like how people make it out to be, So it has to be diagnosed correctly and treated properly. So I would really suggest people to not self-diagnose fungal acne, because then they are going ahead and just taking antifungals and applying these creams which are not going to be beneficial to them. So if you feel that it's a fungal acne, please consult a dermatologist and get it evaluated and diagnosed correctly. That is important.
So the other day I had a red lesion on over here. Okay, so that will be an inflammatory
Yes, correct.
acne. So which means that I'm prone for acne.
Yes, so inflammatory acne can be either papule, pustule, nodule, or cyst. So I can see like you have a little bit of scars on your face.
Correct.
So you do have acne-prone skin. You must have had acne during your teenage years or in early adult life, which has left behind scars. So for you, definitely following a skincare routine that helps in controlling acne, like helps in reducing the sebum production, helps in reducing the dead skin buildup, can really help in maintaining your skin.